It's a Northwest lifestyle weekend on Como News. This is IRG's Health Talk. Back to Tom Hutler and Shannon O'Kelly.
All right, our first guest today is Dr. Alma Garcia, a board-certified physiatrist from Seattle Spine and Sports Medicine, talking about SI dysfunction. And Shannon, tell us a little bit about that.
SI dysfunction. SI, Tom, stands for the sacroiliac joint, the big joint in your buttocks area that your hip bones come to. It's a large joint, a lot of connective tissue, a lot of weight distribution, a lot of torque going through that. But when it's injured, boy, it can be painful because everything moves from your SI joints. You have a left SI joint and a right SI joint. Don't you feel lucky?
I do. And so I was concerned that the SI dysfunction meant I had my Sports Illustrated subscription had lapsed. Let's hear our conversation now with Dr. Alma Garcia.
Dr. Garcia, welcome to Health Talk. How are you doing today?
I'm doing well, thank you. Thanks for having me.
Well, thanks for joining us. We're going to talk about the sacroiliac joint, these two big joints you have on your left and right side. But before we get into the topic, SI joint dysfunction, how's that sound? SI joint dysfunction. Tell us about your practice, your area of interest.
I'm a physiatrist. So a physiatrist is a specialist in physical medicine and rehabilitation, and I work with Seattle Spine and Sports Medicine. We're actually a group of physiatrists, and we actually have 3 locations, Seattle, Linwood, and we just opened up a clinic in Renton. So,
in kind of simple words, and so our listeners understand, because the word physiatrist, it's a big word, and I want to get some meaning to it, and so maybe we can describe it as kind of you guys and you folks and you physicians in the world of physiatry work in the musculoskeletal area of medicine and really are kind of the investigators, detectives of problems that people have with their musculoskeletal system, kind of in a nutshell. I kind of like to describe it like that. Would you agree?
Yeah, that's right, Shannon. Absolutely, yeah. We like to take pride in doing a really thorough physical examination, getting a full, thorough history with the patient, and really taking our time to make a definite diagnosis.
Yeah, and I like to describe that as you guys have kind of this big toolbox, if you will, of things that you can get into to do diagnostic tests. And that's why, as a physical therapist, I've always liked and enjoyed working with the physiatrist, because the diagnostic ability that you folks do really helps us in the rehab, well, both of us and the patient. So it's a nice team effect, isn't it?
Absolutely. Yeah, we so not only from a physical exam standpoint, but as you mentioned, tapping into diagnostics. We can do electrodiagnostic studies. If we feel that further imaging is required, such as MRIs or X-rays or things like that, we can have that arranged. And just to really establish a good diagnosis, sometimes even more intervention is needed to establish a diagnosis, such as a diagnostic injection or something of that nature. And those are things that we can usually do.
Okay, here we go. Let's talk about the SI joints, all right? We know we have a left and right one, but maybe on the radio, let's go back to, I like to call it Anatomy 101. Describe these SI joints, big, large joints, a lot of stress, a lot of torque going through them. Let's talk about them virtually if we can on the radio.
Absolutely. Yeah, it's a little hard without showing you in person, but on the radio, we have 2 SI joints, and that stands for sacroiliac joints, and they're right at the base of the spine, right at the bottom. We have one on each side. So right above your tailbone, there's a bone called the sacrum, and that's connected to the ilium on each side, which is part of the pelvis. And so where those bones attach, where they articulate, we call that the sacroiliac joint. And so that joint can sometimes become inflamed. It can become hypermobile. There can be injuries to the joint itself, trauma to the ligaments that support the joints, and that can cause a lot of pain to those joints.
Yeah, for our listeners who have never had the opportunity to take anatomy class, if you take anatomy class and see this joint, it is really supported with a lot of ligaments, connective tissue, and to irritate it and stress it, usually it's overuse or sometimes it's traumatic events. Maybe describe mechanism of injury.
A lot of times what we see in our clinic, especially in car accidents, we see a lot of car accidents, people get hit from behind. Usually ends up being more of the right side because the foot is slammed on the brake and all that force goes through the leg and through the hip and into the sacroiliac joint on the right side. But you can see it on both sides. Repetitive stress, people that are heavy lifters, runners, that can also cause some irritation, inflammation of those joints. After pregnancy, you'll see this a lot.
Right.
Because the ligaments will loosen up, and that's part of the natural childbirth. Sometimes women have a hard time getting those ligaments to get back to normal after childbirth. So we'll often see that postpartum as well.
We'll be back with Dr. Alma Garcia after this timeout on Como.
It's a Northwest Lifestyle Weekend on Como News. IRG's Health Talk continues.
Our conversation with Dr. Alma Garcia continues now on Como.
Again, Dr. Garcia, thank you for taking time to come down and talk to us on Health Talk about the sacroiliac joint and SI joint dysfunction. Did a great job kind of anatomically describing it, mechanism of injury, but signs and symptoms. I mean, how is someone going to present that makes you kind of feel like, oh, this is SI joint dysfunction?
So a lot of times people will have low back pain. A lot of times it can radiate into the buttock and the glutes. Sometimes even down the leg you can have sciatic type of pain. And sometimes it can be tricky to diagnose and to differentiate from other similar conditions such as a pinched nerve from the lower back, usually what we call a radiculopathy, piriformis syndrome, other types of referred pain and pattern. Sometimes even hip pain from the hip ball and socket joint can sometimes cause similar type of symptoms. So what we look at when we diagnose, thorough physical examination, looking at there are different tests that we'll do in the office to try to figure things out. Sometimes it does require some diagnostic imaging to rule out other things such as a pinched nerve or like with a disc herniation or something like that. But most of the time it's just physical exam, a good history and physical examination. Sometimes the best diagnostic test is just to inject a little bit of lidocaine into the joint itself. And if all the pain goes away, then that pretty much confirms that the sacroiliac joint is the central cause of the pain. And I'll usually throw in a little bit of corticosteroid to the joint as well with that shot to hopefully give you a little bit of relief going forward as well.
It's one of those joints that I guess it's not really involved a lot in musculoskeletal problems from a standpoint because I've always found it to be so well protected and so stabilized, but when it does get involved, it can be hard to diagnose, and you have to do what you just described. When you're injecting that lidocaine in that joint, are you doing it under fluoroscopy? So you can do it under a guided imaging?
Yes. So we usually do it under fluoroscopy, which is a moving X-ray, and that just helps it to be a lot more precise. We want to make sure we're right into that joint. Sometimes we can use ultrasound as well for patients that can't go under X-ray machine, but most of the time it's under fluoroscopy.
You know, it's a joint that I don't know in my practice if I've ever seen arthritis in that joint. Have you ever seen arthritic changes in that joint under X-ray when you do the diagnostic test?
I do actually. You'll see some arthritis. Usually in older patients, of course,
right,
or patients that have had trauma in the past that over time that will cause some degeneration. Usually it doesn't really change what we do in terms of treatment a whole lot. You're just trying to get that to calm down, and also trying to mobilize the joint as much as you can to try to take pressure off the joint, and usually that involves having good physical therapists to get involved, do some manual therapy, core strengthening, exercise, things like that. Sometimes a good chiropractor that can come in and do some manual therapy as well. So those are some treatments that people can have. I
think for both of us in the areas that we work in, once you kind of figure out what you're treating and you find that what we call that comparable sign, and then you start establishing that treatment plan, outcomes are pretty good.
Yeah, absolutely. So if we're able to establish a good diagnosis right off the bat, get people in a good treatment program, some good physical therapy, maybe an injection, maybe some anti-inflammatory medications, get people on the right track, they usually have a pretty good outcome with this.
There you go. Everything you need to know about SI joint dysfunction in 10 minutes. Congratulations, and thank you for your information, Dr. Garcia. Have a great day.
Yeah, thank you.
All right, that's been a conversation with Dr. Alma Garcia, board-certified physiatrist from Seattle Spine and Sports Medicine, SI Dysfunction. Something that's apparently quite painful when it happens, huh?
It's extremely painful, but it's a large joint with a lot of connective tissue. So if you do injure it, it's usually a traumatic event or some kind of high-speed event.
Okay. You can get more information, by the way, at seattlespine.com. Our next guest, Ali Schutz, coming up next on Como.